The Children's Cancer Hospital Egypt 57357 is one of the most stunning examples of what can be achieved when people work together for the common good of their community and world. The people of Egypt have worked together since the inception of the idea of building a state-of-the-art children's cancer hospital to achieve the dream of a better tomorrow for our children, who, compared with the 75 to 80% survival rates in the West, have less than a 40% chance of being cured from their disease because of lack of adequate facilities, treatment, and expertise of all levels. In 1998, a dedicated group of Egyptian pediatric oncologists, businessmen, and philanthropists established a non-governmental organization, the Association of Friends of the National Cancer Institute, to begin the process of funding, planning, design, implementation, and construction to build the largest children's cancer hospital in Egypt, the Middle East, and Africa, and to build and sustain it completely by donation. The design concept of form following function was utilized so that the design would be user-friendly for patients and staff and would be responsive to patient care, education, and research needs for the coming decades. The interior theme, widely utilizing natural light throughout, and the selective use of color, is intended to make the hospital an appealing place for children who will feel a sense of hope, security, and a home-like atmosphere. The patient rooms are single or semi-private to reduce the risk of infection for our immunocompromised patients. The hospital is staffed by 85 physician specialists in pediatric oncology, surgery, neurosurgery, diagnostics, and orthopedics, with the majority hired full-time to the hospital. The spacious 22-clinic outpatient department sees patients who are coming to the clinic for first-time visits, treatment planning, scheduled chemotherapy, symptom management, and off-treatment follow-up. The objective of the day treatment unit is to provide all outpatient treatments such as chemotherapy, hydration, long-term antibiotic therapy, blood products, and minor procedures in an atmosphere that is conducive to wellness and promoting activity, but at the same time provides comfortable loungers for the long hours of treatment. The principle of pharmaceutical care and clinical pharmacy have been applied in our state-of-the-art pharmacy to achieve cost-effective positive outcomes for the patient through patient-staff education, close follow-up, and proper preparation, as well as advising the physician and nurses regarding drug incompatibilities, adverse drug reactions, and new drug information. The objective of the radiology, nuclear medicine departments is to provide the best quality imaging information that clinicians require to diagnose and treat the patient. The department is equipped with the most up-to-date versions of CT, MRI, fluoroscopy, ultrasound, angiography, bone scan, and the first PET CT scan in Egypt. The cyclotron, which produces the radioactive material for the PET CT, is under construction and will be operational in the next few months. The CCHE Laboratories provides all the necessary services to perform the leading-edge cancer diagnostics, such as cytogenetics, immunophenotyping, and flow cytometry, that are an integral part of treatment planning and determining outcomes in a timely, cost-effective, and measurable methodology with the highest quality. The aim of the intensive care unit is to provide comprehensive care to children whose body systems are in an acute state of distress that requires intense observation and monitoring. The 10-bed unit and 10-bed intermediate care is designed for one-to-one nurse-patient observation, and all patients are in private rooms with a view from the nursing station. The vision of the Psychosocial Oncology Department is to introduce psychological and social care for the child with cancer and his family through a multidisciplinary team approach, so they will find ways to improve quality of life, manage their fears, and find hope for their future. The department is the first of its kind in Egypt, recognizing that psychosocial oncology is a unique specialization, meeting the unique needs of a patient and family faced with the devastation of the cancer diagnosis. The 6 operating theaters and 22 stretcher phased recovery room are state-of-the-art and have all the essential equipment and instrumentation to perform complicated cancer surgery such as microsurgery, laser surgery, and neurosurgery. The rooms are spacious and have the necessary air handling to keep the department infection-free. The nurses are well trained in the principles of aseptic technique, anatomy and physiology, and surgical nursing to assist the surgeons in their work. The Children's Cancer Hospital Egypt administration believes firmly that implementation of a volunteer department is necessary to encourage the community to take an active part in the hospital. Becoming an automated hospital will not only manage data better, but improve the work of the hospital more efficiently, reduce errors, and be more cost-efficient, as well as being the foundation for future research. Collaborations have begun with other centers such as Dana-Farber Cancer Institute, Children's Hospital of Boston, and St. Jude's Hospital to bring foreign expertise to teach staff, as well as sending individuals to these centers for specialized training. In conclusion, the Children's Cancer Hospital Egypt 57357 is an incredible project that is a true example of the goodness of mankind and what can be achieved when people work together for a common goal. As Margaret Mead said, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. Hospital 57357 will be seen as the watershed that moved healthcare into a new era in the developing world because it has developed a model that all may follow.